Hello, my name is Mohammed Mazik Balbi Mawala and I'm a student of National College of Ireland. I'm doing my Masters in Data Analytics and my student number is X17155282. My topic for research in computing is prediction of diabetes using data mining techniques. In this presentation, we will go through introduction, objective, research methodology, conclusion. Diabetes mellitus is a serious disease affecting millions of people around the world and is expected to grow at an alarming rate. Body produces insulin in the pancreas, which is varied in diabetic patients. In some it is in abundance and in some there is lack of insulin production, which is directly proportional to the variations and fluctuations of blood glucose levels in the body. It is essential to maintain a good glycemic control to avoid not only short-term complications of the body but also the long-term complications. Short-term complication is diabetic coma, which is caused due to the hypoglycemia, which is low level of blood glucose level and has led to death of the patient eventually. Long-term implications of the diabetes are renal failure, sore and infection in the feet, nerve damage, blindness, urination, frequent urination, sweet tooth, frequent hunger, etc. Now we will discuss the objective of this research. The objective of the research is to find out new features and factors or parameters that can bring a literal change in the prediction of diabetes, verifying the accuracy and classification of support vector machine learning algorithm, exploring the field of diabetes using decision tree algorithms using the random forest and the gradient boosting. In this research, the methodology which we are going to use includes support vector machine learning algorithm, decision tree and random forest algorithm. Support vector machine learning algorithm is a very powerful algorithm as well as commonly used for classification. When used in combination with decision tree, random forest and other machine learning algorithms, it gives a very valuable outcome and it gives a new dimension to the research. Medical data sets are very crucial and requires very high power of prediction, and this SVM serves as a boon for the research. In our research, support vector machine will help us in finding out the features which are important by comparing each feature, or in simple terms the columns, with each other and try to figure out which feature is more helpful in predicting the diabetes. After figuring out the features which are highly classified, we can use the results of support machine and use as input to other machine learning algorithms that we are going to implement, like the decision tree, random forest, or any other. Decision tree is also supervised learning algorithm. Decision tree is usually used when there is predefined target variable. In our case, the prediction of diabetes in a patient, whether yes or no, based on the other variables, which is also called the independent variables, is the target variable. Independent variables are also called parameters, factors, or it is basically the columns present in the dataset. Decision tree is most commonly used in classification problems. Decision tree splits the population or the entire dataset into two or more than two subsets based on the differentiator in the input variables. For this research, we are using decision tree algorithm to classify all the features based on the value ranges that are ideal for the body, and we can set the ranges which can help in deciding which features or factors or parameters or the independent variables are exceeding or are below the desired range of values. Random forest is the extension of decision tree algorithm, or vice versa. It is a very useful algorithm as it can be used for dimension reduction, treating the missing values, finding out the outliers in the dataset, and most importantly can be used for classification and regression both. Benefits of random forest are numerous. One of the major important features of it is capable of handling large dataset with high dimensionality, and the output of it includes the importance of variable, which is very important in our case and is a useful feature for most of the datasets. In our research, it can be a boon to use random forest. It can do most of the data processing and exploration within one algorithm, and hence it can be very beneficial for our research. In this research proposal, we have understood about diabetes. We have seen a detailed literature review of the work done in the field of diabetes prediction in the paper submitted. And we have also discussed about the methods that we are going to implement to predict the diabetes. The main objective of this research proposal is to develop a novel machine learning algorithm technique to predict the diabetes and search in detail what factors or features or parameters are more important and are should be taken care of for the prevention of diabetes. Thank you.